It's another day with the physicians where your health is our business. With growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that not only when your pressure is high, that you have glaucoma.
And I don't know about any other one, but what you know is
You're welcome back to the training culture of your regular program.
Childbirth is a very big factor. It is actually a sine qua non of prolapse.
Malaria is a disease caused by a parasite. It spreads to humans through the bites of infected female Anopheles mosquito. While the disease is uncommon in temperate climates, malaria is still common in tropical and subtropical countries. Each year, nearly 290 million people are infected with malaria, and more than 400,000 people die of the disease. The Rollback Malaria Partnership's top advocacy goal is to align and activate the global community to support a fully replenished global fund of at least $18 billion for programs between 2024 and 2026. How have we fared in Nigeria in terms of curtailing this very disease called malaria? It looks very common. It is very common. People take it with kid's glove. But it is also very dangerous because it kills. Maternal health is highly affected. Even female children's health are also very affected. On the regular program today, the physicians will be discussing malaria, the symptoms, presentations, the treatments, management, and possible complications. Don't go away. Stay tuned. We're back after this short break. It's another day with the physicians where your health is our business. Today we'll be talking about something that you know very well, but whether you know how to manage it, that I can't say. We're discussing malaria, the signs, the symptoms, the complications, the prevention, and of course, the presentation. My name is Dr. Martina Agbere, your regular host on this program, The Physicians, where your health is our business. And of course, I'm not alone. I'm here with my guests. Very elegant and cerebral, consultant public health physician. She is also a senior lecturer at the College of Medicine, University of Lagos. She is Dr. Oluchi-Kanma Okafor. Doctor, you are welcome to our program.
Thanks so much. Thanks for having me.
I always love to see you when we have to discuss public health matters. Now we want to be talking about malaria. You know, everybody say, I have a malaria, doctor, I have malaria, I have this and that. And the patient will just come to you and say, doctor, I have malaria. How do you know that it is malaria that you have? Maybe we need to let them know. Give a general overview. What is malaria?
Okay. Thank you, Dr. Martina. Glad to be here. So malaria is an infection caused by the transmission of the parasite, Plasmodium, through the bite of the female Anopheles mosquito.
So it is the female Anopheles mosquito that is responsible.
Yes.
So all those bites that we have, even if the male ones also bite, the males don't transmit the parasite.
Yes.
Right?
Yes.
Okay.
So that's how we get malaria.
Okay.
Now, the symptoms of malaria are such that it resembles those of so many other diseases. And that is why people, like you said, people will come to you and say, doctor, I have malaria.
Okay.
But not every fever is malaria.
Not every fever is malaria, absolutely. What are the presentations normally?
Okay, typically, a person with malaria would complain of fever, that is hotness of the body. That's what fever is, a high temperature. And the person can feel it when they put their hand on their body and they think that I'm hot, or they feel that they're hot. And then maybe they check with somebody else and they feel that, oh, this person is cooler than I am. So that's fever, hotness of the body. Then most people will have a headache that is just persistent. The fever, many times the individual will be fine in the daytime, but towards evening they will start having the temperature, they'll feel unwell, they need to go lie down. So later in the day, like from afternoon, maybe from 2 p.m., 3 p.m., they start getting feeling uncomfortable. Then sometimes they have a bitter taste in the mouth. Some people lose their appetite. Some people have abdominal pain. It will also go with runny nose, cough sometimes, and then the person can have other abdominal symptoms like diarrhea. Some people also experience a lot of sleepiness, malaise, they're so tired. Sometimes they have body pains. So you say somebody has, they say, oh, I have pains all over my body. Okay. So sometimes that goes with malaria as well. So the symptoms, fall within these groups.
Okay. So now you talked about the general symptoms. General malaise, feeling tired easily, loss of appetite, sometimes headache, and at times even abdominal discomfort, diarrhea. And of course, the first thing is most times is the fever that they experience when you touch the person's temperature is a bit high. Now you've talked about that. That is general. So let's see, are there types? Well, let's talk about the types of malaria that we have. What the classification?
When you talk about the different types of malaria, I'm looking in terms of complication.
Complicated and uncomplicated malaria.
So the typical malaria you have is when the person feels unwell, and then the person takes their available treatment and gets better, takes some rest. In a few days they feel better.
Okay.
Complicated malaria would go beyond that.
Okay.
So would have other things added onto it.
Okay.
So malaria can become cerebral. The person can have begin to have chest signs. Can begin to have malaria that would cannot be treated. So I'm running away from terminologies.
Okay.
I'm trying to stay general. But when malaria goes from the ordinary, then it's complicated. So malaria typically, if the treatment modalities are adhered to, stays uncomplicated.
Okay. So do you want to talk about the management? How do you manage a patient who has a malaria? The patient comes now, I have a headache, I can't eat properly, my appetite is gone, and I don't even sleep well in the evenings. Throughout the day, I feel a bit well, but as the day progresses, I begin to feel feverish and generally gets weak. So how do you manage a patient that has malaria? What are the treatment options that you have?
Okay, so I'll take it from two perspectives, from the point of view of the patient or their carer, or whoever it is that is providing that they're with.
Provider?
So that's for the individual, what the person can do.
Okay.
So you start having on the symptoms. So if you're the caregiver of a child that has these symptoms, above and beyond everything else is to get medical help. That is from the correct person. That is a doctor, a nurse, or a health professional in a health center. So what can we do at home before going there? For example, the child develops a fever right at home in the middle of the night. What do? The first thing is to bring that temperature down.
Okay. Is there any reason why you bring the temperature down for a child?
Yes, for a child, there's always that. You don't want it to become complicated. So you don't want the child to maybe develop a seizure.
Okay. Convulsion.
So yes, a seizure is convulsion.
Yeah.
But a seizure. So the first thing to do is bring that temperature down. You can do some very simple things to bring the temperature down. For example, take off at least one layer of clothing. Typically, maybe children will wear an inner wear, outer wear. Take the outer wear off, and if possible, take the inner wear. Let this child just get some fresh air. Then get if you have, most people have a painkiller or an antipyretic, an analgesic in the house. So typically, if you have whichever of the antipyretics or analgesics you have at home, let that be used. The right dosage, let that be used for that child, and immediately seek medical attention. So the essence of doing those things at home is to prevent it from worsening into a convulsion.
Okay.
So typically, when you get to the healthcare provider, they will give you an anti-malarial. But anti-malarials should be given. The right thing to do is to have a test done, and that's why we have kits right now.
The diagnosis.
Yes, the kits right now that allow a random tests.
Okay.
So it's a rapid test that can be done very rapidly, right there at the doctor's table.
Okay.
So it's called the RGT. Let that be done. Once malaria is identified, then the right treatment to be given. So nowadays we go with artemisinin combination chemotherapy.
Okay. So when you talk about artemisinin combination therapy, what do you mean? In the past, we used to use chloroquine.
Yes.
Okay. So why did we stop using chloroquine?
So partly because of misuse of drugs.
Okay.
So because these parasites sometimes they're sensitive to the environment, they change to suit the environment. Because of inappropriate use and largely drug abuse, the parasite became insensitive to chloroquine. So many times you'll find that some people, you can use it, it gives that immediate relief, but the parasite is not taken out of the body. It's not. It might be wiped out of the bloodstream, but might still be resident in the liver, and so the person has another bout of malaria soon after.
Okay.
So the parasite is not completely cleared from the body, and that's because of misuse of the drug over time.
Okay.
So right now we've moved on to a different level of treatment, which is artemisinin-based combination chemotherapy.
We have moved out to another line of treatment, the artemisinin-based combination therapy. When we come back, we'll deep dive more on that particular one so that our people will know the reason why they have to use this combination drug and not always say, I have always used chloroquine. It is only chloroquine that can take care of my malaria. I'm sure you are keeping up to date with us, enjoying this program, talking about malaria, the signs, the symptoms, the possible complications. Let's hear what you have to say out there about malaria. Don't go away, we'll be back after this short break.
Malaria is an illness.
Malaria is all about mosquito. Whenever mosquito bites you, then we feel dizzy. You get the symptoms.
Malaria is a disease caused by parasites like mosquito that is a common in this western region.
I believe in traditional medicine.
We need to take care of our environment. Maybe our gutters, and then our indoors, we need to take care our indoors. Maybe we need to fleet or do to where we have some place that there's some water gathered, so we need to take care of that.
Just keep good environments and also use your mosquito net. They have mosquito net which the medical professionals has bring us that is the best solution.
The traditional means and the going to the hospital. I prefer traditional method. That is preparing of concoction with herbs and leaves together with roots.
Which other options of treatment for malaria do you know?
For some people usually went to hospital, take injection or whatever. But personally, I usually took agbo.
In my own opinion, there are some people who like to use the herbal way, which is all this agbo, a native way of preventing and curing the malaria, while by some go through medications, from taking advice, run a test, taking advice from the doctor, doctor description of drugs and others in pharmacies.
Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. We've been discussing malaria, the signs, the symptoms. Talking about the preventive measures, the treatments, and of course the possible complications. And in the studio with me, Dr. Oluchi-Kanma Okafor. She is a consultant, public health physician, and also a senior lecturer at the College of Medicine, University of Lagos. She's been schooling us on malaria. We actually think it's just an easy health condition. A lot of us take it for granted, but there's so much more to know and learn about this particular disease called malaria that is caused by the female Anopheles mosquito. Okay, we talked about the combination drugs, why they will no longer use chloroquine, even though some people still respond to the use of chloroquine. And we're not talking about the use of combination drugs. Okay, so why are we using that combination? Is it because of the abuse? Are we not sure people will still abuse this combination therapy?
Thanks for raising that concern. It is a very present concern because of the way we do things here. We buy drugs over the counter in Nigeria. So some of these drugs are licensed to be bought over the counter. And so people buy them and they don't use them adequately. So the message there is people should use these drugs adequately. If you think you have malaria, as much as possible, try to get diagnosed. These rapid tests are available. Even in the pharmacies, they are available. Try to get diagnosed before you use anti-malarial. And once you are diagnosed and you start using it, try to complete your treatment. Okay. It's not that when immediately you feel better, you stop treatment. Try to complete the treatment because it's just for 3 days. Okay.
I want us to also school viewers, because most times they will tell you, doctor, have done malaria test, it is negative. Is it all negative reports that confirms that you really don't have the parasite in you?
That's the essence of the test. Okay. Because like I said, not all fever is malaria. A person might present typically as malaria but has something else. There's a myriad of infections that look like malaria. So what I often tell some of these patients, I remember medical school, they will always tell you, you have to look at the patient critically, and even if the result comes out that it is negative, you need to take the patient's situation into consideration. All the signs and symptoms, the presentation, after you have ruled out every other thing, bearing in mind that malaria is endemic in our own environment, and also considering the life cycle of the years. So most times, maybe when they take the time of the blood, when they took the blood sample, it's also possible it is not already in that liver phase. So I tell them, it is not all the report that is negative that will we have to look at a lot of things before we can also treat you for malaria. Yeah. But I'm happy about this, the rapid kits that is available. Okay, now we've talked about the treatment, the reason why we have to use the combination medication, hoping and praying that people don't abuse it anymore. Can we talk about the prevention of malaria? How do we prevent it? Yeah, more importantly, more important than treatment is prevention. That's the higher level of managing malaria. Preventing malaria is easy and very basic. So the first thing to do is to ensure that you don't get bitten by a mosquito. And how do you do that? By maintaining a clean environment. So where does the mosquito thrive? In stagnant water.
Stagnant water?
And in bushy places that have spaces for them to hide. So it grows in
like flat pots too?
It grows in stagnant water, but it hides among bushes. Okay. So if you can eliminate all stagnant water, clear the bushy environments, and prevent whatever malaria is left from getting into our homes by netting our houses, and then preventing whatever got into the house by getting to the person. You typically, when you're unconscious, that's when you're sleeping, by using insecticide-treated bed nets. And if we don't have that, if maybe we have to be outside wearing protective clothing, long sleeves and trousers, and if that's even with that, maybe insect repellents that can work. So there are different levels at which you can apply preventive measures. But the important thing is to protect ourselves from being bitten by the mosquito. That's the first thing.
Okay.
Then the next thing to do is maintain a good level of health, because typically, if we were to succumb to every single bite of the mosquito, we'll have malaria so often. But many times the body can cope with it, because your natural ability to fight infection might aid the individual. So maintain a good level of health so that if you do get malaria, it wouldn't become complicated. So those are important. Good nutrition, exercise, good hygiene. These are very important measures.
Okay. How about using insecticides?
Yeah. So
apart from the insecticides, you tried the nets. How about the sprays?
Yes. So that
we also use.
That is a measure even adopted by the government to control malaria. So it's called indoor residual spraying, using insecticides. These are done indoors periodically. So this is also a good measure. And many times some people buy, insecticide sprays and spray their homes. So that's another measure, but we must be careful. Some people cannot cope with the fumes that come from those sprays, or maybe when children are, and we don't know the long-term effects of those sprays on the body after inhalation. So there are several measures that can be applied. So malaria largely can be prevented.
And it's very fatal, so can be?
Yes.
Yes. How about for pregnant women? How are they supposed to prevent this?
So this is a bit of an advocacy for antenatal care.
Yeah.
Antenatal care. Every pregnant woman should avail herself of antenatal care, because number one, it's free and it's necessary. Because when they attend antenatal care, they're giving anti-malarials to prevent malaria. Because malaria and pregnancy can end catastrophically.
Absolutely.
And so malaria and pregnancy is best prevented. So the idea is for pregnant women to just register and attend antenatal care.
Okay, before we talk about the let's talk about the complications, possible complications, if it's not well managed.
Yeah. So
what are the things that can arise?
So just very simply, because malaria is an infection in the blood, that affects the red blood cells. If a red blood cell is infected by a malaria parasite, after a while it breaks down, because it's no longer wholesome. It breaks down, and then it becomes a damaged red blood cell. It ceases to function there. So the important thing is, if too many red blood cells are affected and too many of them break down, then the person might have a low blood level. So the person may have anemia. And so that's what you want to prevent. And that's why we encourage being healthy even before you get malaria, so that you have enough red blood cells, so that even if some of them get affected by the parasite, the individual, even after the red blood cells have been damaged, will still have some red blood cells and has the folic acid and the environment in their body to produce more red blood cells. Okay.
Just that anemia alone can actually cause a lot of other problems.
Yes.
Because you're normally, when your red blood cell is okay, the red blood part of it is going to carry the oxygen. So if your red blood cell is broken down, you're not able to carry enough oxygen, you become distressed, you become tired easily. A whole lot of things can actually arise from that low red blood cell. But then for the cerebral malaria, how do you, because that is cerebral, when the thing has gotten to the brain, what are the presentation when a patient has cerebral malaria? How do the patient present? How do you know?
It is hoped that whoever develops malaria should have been managed well to the point before it gets to that. But if a person has cerebral malaria, one very obvious thing is the person might be delirious. Okay. Might not be well, in the sense that they're not well oriented in person, in place and time, so they're delirious. Or they could be unconscious, or they could present with seizures. So We hope that malaria doesn't get there, but that's a serious level of malaria. And then the typical treatment for malaria, that is the ACT, will not be what to do at that time. It now requires hospital care and then hospital level management.
Before I let you go, in Nigeria, roll back malaria, what do you think we have done so far? How has it gone? Are we doing well? How has it gone? Just give us just something to make people.
So we have our programs, and we have you know, the funding to address malaria at different levels. Okay. And I must say that we are doing it. Okay. We are doing it. So at different levels, that's going on. So the goal is to eradicate malaria. You
think it's possible to eradicate malaria?
I think it's possible, okay, because even work is going on towards a malaria vaccine.
Okay.
So there's work going on at different levels. So okay, the aim and the goal is to, you know, end malaria. And there's a target to end malaria. And there are so many things that we ought to do.
Okay.
Towards that target, and that's ongoing. Okay. So at the individual level, maybe each and every one of us can contribute a bit by making sure that we protect ourselves and prevent malaria.
Last word for our viewers?
Well, I'll say that malaria, sometimes we treat it as if it's nothing, as if it's not important, as if it's part of our lives. Some people say, oh, I haven't had malaria this year. Oh, why? Why haven't I had malaria this year? They want to have malaria every year. And then, so they're worried about it. But malaria is an infection, it's a serious infection, it's fatal, and we should treat it as such. There's this other thing that I want to bring up. When people have malaria and they combine it with other diseases, they give it a new name with other diseases. We should avoid abusing medication just because of malaria. Let's go to our doctors, let's go to our nurses, let's go to our health centers provided to provide treatment and get adequate diagnosis for malaria and treat it properly.
Okay, thank you very much. And I know because of the incubation period, if one is not properly, care is not taken, one can actually have it every 3 to 4 weeks based on the incubation period. Well, I've heard it all from Dr. Oluchi-Kanma Okafor talking about malaria. It is actually in an environment that is endemic. So it'd be very good if you are able to take very good care of your health. Ensure that you do not allow stagnant water around you. All those flower pots, ensure that you take very good care of the flower pots, that mosquitoes don't breathe there. Then anything that is dead, take it away from your place. The grasses that are, just ensure that you do your proper horticulture and ensure that you cut those grasses over there. Then finally, make sure you have your nets. Your house will be properly netted such that mosquitoes, or at least the ones that will come in, it will be minimal. Then you also have the mosquito, insecticide treated net. For those that can use it, is available. Try as much as possible. Then for children, make sure that they always wear long clothing to protect them, because for children and malaria, it's not always very easy with them. So on this note, we want to say thank you so much for keeping it dead with us on your regular program. The physicians, same time next week, I just ensure that you call a neighbor, a friend, a family to watch the program, and always ensure that you give us a feedback on our social media platform. You can always reach us on Facebook, on Instagram, on YouTube. And if you want to be part of this program, you can just send us an email and we will invite you. My name is Dr. Martina Agbire. Till next time, stay blessed.
Everybody, my name is Yewande Adekoya. I'm a pharmacist, a wellness and a lifestyle coach, and I'm here on The Physicians talking about self-care. Self-care is taking yourself seriously, putting premium on yourself, and living an intentional life. It is important that you make that decision for yourself, by yourself, to yourself, so that you can live a happier, satisfying and healthier life. Thank you for watching The Physicians.